Hello, good evening, good morning, everyone who is watching this video. My name is Sakib. I'm one of the IELTS and OET expert working at A2Z English test preparation. And today we are going to talk about the OET reading sub-skill test. So let's get started. Welcome to A2Z English Test Preparation. It's an international company providing general English and English test preparations to individuals and different corporations around the world. So today we are going to unlock the reading strategies for OET, OET reading sub-skill test. Let's first have a look at the OET reading test structure. OET reading sub-test structure consists on three different parts. Part A, Part B, and Part C. Please pay very close attention to that. Part A is in nature, it's an expeditious text, which means that this text contains tasks which must be carried out in a time-efficient manner. The Part B and Part C require a bit more detail and a careful reading to get the correct answers from the text. Here is very important information that I'm going to talk about. You really have to consider this when you're attempting OET reading, that which skill is being assessed by the OET examiner in different parts. So then, when we learn the strategies of the reading, we are in a position to apply those strategies in a relevant text structure. So first, Part A, it evaluates your specific information, not but your ability to locate a specific piece of information from a long text or a short text or too many texts. And the key here is that time, that for example, the reading test lasts for about 60 minutes and you have around 42 items to find answers for. And these, if you divide 60 by 42, you get 1.42 seconds for each question. So that's quite challenging. So the Part A evaluates your specific ability, your ability to locate a specific information from a different text, okay, or different four short texts, A, B, C, and D. And Part B evaluates the ability to identify details, gist, or the main point of 6 text paragraphs. Very important that you have to understand, bear in mind when you're doing a conscious preparation, not a random preparation. Conscious and deliberate preparation means that you understand what each criteria and what each part of the reading evaluates, and you prepare yourself in line with those assessments that each part does. And Part B, your evaluates your ability to identify the details, the gist, or the main point. So these are the skills that we are going to focus in our training, right? However, we are going to discuss few of them in today's lecture because it's quite brief and we're just going to practice few questions after we learn few techniques. But the detailed strategies for reading we're going to talk about in any other lecture. Identify the details, gist, main point. So these are the skills that I'm circling that OET, two different parts, assess. And we will help you to develop these key skills which OET reading subtasks assesses. Okay, so let's remove the annotation and move on to the next slide, what it has for all of us. Okay, as I mentioned earlier, that you require to master the key reading strategies. I'm not going into the semantics of these key reading strategies detail as time does not permit. So I'm going to just overview them, that what those strategies are. And we definitely, in our paid courses or in our another lectures, we are going to cover the reading strategies that you require to approach these questions on the reading test. Again, these strategies work like a tool that you need to land at the answers of these questions. And without these strategies, your most answers would be incorrect, or randomly, maybe you can find some answers correct. And this is why when I speak to different clients around the world and different doctors and nurses and healthcare professionals around the world that have attempted OET tests several times, but they didn't get the score, what they're trying to do is just trying to attempt questions. And few of doctors, they claim that they were getting low scores in the reading part. And the reason is that they're not really focusing on the reading strategies, and they're just blindly going over questions and doing them. And that's not really a right strategy. You really have to have the tools as a doctor. Let's say if you're a surgeon and you're going into the theater, operation theater, and you are going to operate a patient, like if you don't carry tools with you or instruments with you, definitely you're not able to perform good. So understand this analogy, or of course I'm speaking figuratively to help you understand that these strategies work like an instrument for a surgeon, that you must have them if you wanted to succeed in the reading subtask. I've just picked up a few questions from the sample reading available for all on the OET website. And I'll walk you through a few questions just to help you understand how you should read question and how you should pick up the answers and what strategies. Please remember that I'm going to just highlight the strategies, and I'm not going to explain the strategies itself, because this would deviate me from our main topic. So the strategy that we need: skimming skill, scanning skill, keywords, and a paraphrasing, to name few. We require them to be able to locate the answers of the question on the reading test. Here are questions now. These questions are actually, we call them a matching information, as there are different types of question, but we picked up a matching information question. That 4 paragraphs, or the 4 short text in part A you'll be given. Again, in part A, you'll be given a short 4 texts, right? And this type of question, which is matching information, in fact, asks you that you have to identify that this question belongs to which short text, A, B, C, or D. And then definitely within a short span of time, which is 1.42 seconds, you really need strategies. Strategies work like a ladder to locate the right location in the text and grab the correct answer. Okay, so let's get started. Now, let's read the question. A lot of the practitioners or the healthcare professionals, they make mistake in even reading question. They don't read the question carefully, and they don't understand the demand of the question, which is why your answer is most of the time wrong. Now, procedures for delivering pain relief. Now, the examiner or this reading task, this question in this reading task asks from us that you have to define, you have to find out that a procedure for delivering pain relief, right, belongs to which paragraph, right? And make sure that you focus on the meaning of the question. Procedure, focus on this keyword, and delivering a pain relief. A procedure for relieving a pain. This question or this statement is being discussed in which paragraph, right? Now we read the question, we have analyzed the keywords, and we understood the demand of the question. So once we have read the question on the reading task, now we'll go over the reading task, and then we will see which text it can possibly belong to. Again, It's a matching information question where we have to find out that this question belongs to which part of the text. Now, just stop this annotation, delete this, and go to the next slide. So the next slide has a text that, again, we have taken from OET sample tests. Text A talks about what it fractures and buckle and break bone often occur following indirect injury. Text B is a simple fracture of limbs. Now, here is a key point. Bear in mind that you have only 1.42 seconds to get the answer, right? So let's say if you go over these slides, that how long these text is. Text A, text B continues, and text C, and then text D. So you won't have time to read all these texts in a great detail to find out just one information. So bear in mind that you require strategies which you're going to teach you. Now, here, we are using a skimming strategy, and skimming tells us that we have to get a general view of each paragraph. And in this, we practice also a key sentence strategy, in which we try to learn that the first sentence is indicating or indicator of the remaining content of the paragraph. So the first sentence can indicate the remaining information subject, okay? So when we read the word fracture, it does talk about that the sentence is about fractures, right? And then we skimmed a few more. Dislocation, it talks about dislocation. Sprain is a partial disruption of a ligament or capsule of a joint. So we are actually skimming, and we have to locate a specific information, and we require a scanning skill for that, which we are not doing in detail. We have a separate resource that we use to help you develop these strategies. So this text A doesn't sound a bit relevant to the question. So again, we shouldn't forget the question again. So let's go again to the question. Let's stop this annotation here. The question says, procedure for delivering a pain relief. Now, text B is a simple fracture of limb. Alludes that it talks about the simple fracture of the limbs, immediate management. This is the immediate management that you have to perform, clinical assessment. Anyway, it doesn't sound too relevant to the topic. Let's continue reading. Management explained at the site of fractures. So there isn't any indication that it can talk about the pain relieving procedure. Next, again, text C, drug therapy protocol. Now here we have to focus that the keyword was a pain relieving. And if you see the meaning of pain relief or delivering a pain relief, it's kind of a treatment. And here is the word therapy is synonymous to the word treatment, right? So here we have an indication that this text might contain the information that the question has asked. So let's go over and read the text C to be certain that authorized indigenous health worker must consult medical officer or nurse practitioner, schedule of medicines, rural or in isolated practice, registered nurse may proceed. Drug, form, strength, route of administration, route, recommended dosage, duration. I mean, each paragraph, this is the title of each column. So this talks about, this column talks about drugs. This column talks about the form of the drug, its power, and the route of administration, the recommended dosage, and the duration. Now, here when we read about morphine, and you who are watching this, and of course it is for healthcare professionals, they're well aware that morphine is a pain relief element, right? So morphine indicates that it is used for pain relief, and once it is evident that morphine is a painkiller, then you can also look at the route of administration column that talks about a procedure of administering this medicine. So here, when we looked analyzed at the question type, we've understood it clearly that this question that we have read, a procedure of delivering pain relief or belongs to task C. So the right answer for the question number 1 is C, right? Okay, so you can pause a little bit and also you can answer the question yourself. The second question, the procedure to follow when splinting a fractured limb. Now, you all understand splinting a fractured limb procedure, as you all are healthcare related people and professionals. So we have to identify procedure to follow when splinting a fractured limb. Now, when means indicates that this action, splinting, is a sort of an action, right? And also keep in mind the paraphrasing skill, that the words, information that the question asks may not be written the same words. So we have to focus on the meaning. As in the previous question, we learned morphine, right? However, the question used a delivering pain relief, so that's different. So, but carry the same meaning. Splinting a fractured limb, splinting a fractured limb. Okay, we have to find out that which paragraph talks about the procedure of splinting a fractured limb. Okay, let's go over the text. Remove the annotation and go over the text. Thank you. Let's talk about fractures here. Buckle, break the bone. Does it talk about the procedure of splinting? No. Or the process of splinting? No. Dislocation, it might talk about dislocation majorly, but doesn't seem any connection with the question itself. So let's ignore it. And sprain is a partial disruption of a ligament or a capsule. Doesn't seem so relevant. We are again skimming. In a training, we provided in detail practice, explanation, description of these skills before we move on to the task. But today time is short and it's a general video, so we are not covering everything in great detail. Okay, simple fracture of limb. Now, what do you think? Simple fracture of a limb can contain the information or not? For question number 2. Health at the external hemorrhage by pressure. Doesn't matter if I can't read the medical terminology, as I'm not a doctor, so I'm just language expert, so that's okay. By the way, this medical terminology is a bit difficult to read for a layman. Okay, so it doesn't seem too much relevant, so let's continue reading the text. B, management doesn't sound too relevant. Therapy, drugs, as we have gone through already when we are finding the answer to the question, doesn't sound too relevant. Techniques, yes, that's where we can use a skill of a paraphrasing, which means the techniques paraphrases the word process of plaster backslap of an arm fracture. So that's splinting, right? Use same principles of a leg fractures, okay? Measures the length of non-compression cotton stocknity from halfway up the middle finger to just below the elbow. So width should be 2. This is the procedure to follow when splinting a fractured limb. So the correct answer is the correct answer is D. Let's remove the annotation and let's mark the answer D here and C here. Okay, so there we go. We've covered today a few strategies. We practiced a few questions, part A questions, and the type of question was a matching information, just to give you an idea that that's how our training is all about. We are providing you the details the uh, in detailed structures, information, techniques, tips that you can use to just a second. All right, so this was it for today. And if you really want to give any feedback, or if you require any further assistance for training, you can contact us at info@a2zlanguage.com, and we'll be happy to assist you. Thank you very much.